A trip to the hospital for your heart can be emotional and painful.
Previously, a patient would come in and they'd be in very sick condition. If they were in heart failure or we wanted to see what the functioning of their heart was like, we would have to put in a very large IV into their neck or into their groin, so a very invasive IV.
The CK Huey Heart Centre is seeing yearly increases in patients. Unsatisfied with the speed and risks associated with this test, the centre searched for a non-invasive heart exam.
We've seen lots of machines come by who claim they can do the same thing as that Swan-Ganz catheter.
However, many of these machines did not provide an accurate or less complicated approach.
The NiCast is the first machine that's non-invasive, and with the numbers that we get, we can really trust and make sure we can treat the patient properly.
Compared to the previous 1-hour procedure, the NiCast can provide results in minutes. Fascinated with this almost space-age scientific approach, the team at the Heart Centre demonstrated the test on me.
So I'm just going to apply some ECG electrodes to you. It's very quick and easy, and then what I'm going to do is we'd put this on a wrist and an ankle, or a wrist and a wrist, or an ankle and an ankle. So for you, I'll put it over your pulses on your wrists, just to give us a good connection with your skin.
Should a patient need retesting, these pads can stay on for up to 24 hours.
Before, it was just the critical care patients, whereas now we're using them on One East, our inpatient unit. I've gone and I've helped them in the heart function clinic put it in. They've done it with some of these pacemaker patients to optimize the settings of their pacemaker, to know that we're giving them the best care that we can.
It's very non-invasive, very quick. The training is minimal, but we get almost the same as data as the Swan-Ganz catheter. It's a very impressive machine.
The Conference Board of Canada says heart disease and stroke cost the Canadian economy more than $20 billion yearly. This compact examination is a fraction of the previous price.
For $12 for 24 hours of data is very, very cheap. Now, some of these tests inside the hospital cost thousands of dollars. The Swan-Ganz catheter costs hundreds of dollars.
And in just a matter of moments, I received my clean bill of heart health at the Royal Alexandra Hospital.
And we're the first place in Canada to have it, so we're very proud. Just like the foundation to say thank you to them for giving us this machine, and we want to let the people of Alberta know that this is really good technology for them, and we're getting really good service here at the CK Huey Heart Centre.
In Edmonton, I'm Bianca Jade.